This is Dr. Reem Sharhan. I'm a licensed naturopathic doctor, and one of my specialties is hormone replacement therapy. And I'm going to quickly talk to you about where to apply your hormones in terms of creams. So there are two categories. We have the estrogens, estradiol or estriol, and there's progesterone creams. All of these can be applied on thin skin. So where is thin skin is basically areas where we can see the veins. So that can be the wrist. And my favorite spot is the inner elbow or the antecubital area. And then we have behind the knees. And for testosterone, we want to apply on thicker skin areas. So that is the inner arm and the inner thigh. For any type of typically, compounded hormone, it will come in something called a clicker. I do not have it, unfortunately, here today, but I'm going to demo with an arnica cream. So basically, your clicker will come with a twister, so it will twist, and that's why it's called a clicker. You get a little bit of a dollop of, of hormones at the top, and this is a click. One click of hormone, and then you're going to use the top of your clicker basically to apply the cream and spread it on your inner arm. Sometimes whatever is left, I use, you can really spread it on the area. Whatever is left, you can apply it on the other side. And there you have applied something like progesterone or your bias cream like estrogen, which bias is a combination of estradiol and estriol, or either or. And for testosterone, you're going to target that inner arm, so that where it has to be fat, there has to be fat tissue for something like testosterone, and that applies also to the inner thighs. So that should give you an idea about how to apply progesterone, estrogen, and testosterone. Please like and subscribe. I'd like to see a little bit of interaction with the channel, so that will encourage me to make better videos and more videos. I appreciate you, and I look forward to seeing you in the next video.